booster dose vaccine drive has been initiated in the state of Tamil Nadu. With us, you could see the Chief Minister behind, with the Health Minister over there, and like the frontline workers are getting vaccines in front of him. In the state of Tamil Nadu, so far, 35.5 lakh people have been identified to be eligible for the booster dose. That is the third dose, and their senior citizen couple are also getting their vaccines in front of the Chief Minister. When it comes to Tamil Nadu, so far, nearly 20 lakh plus people have been identified in the above 60 category, and 9.5 lakh people from health workers and nearly 6 lakh people from frontline workers have been identified. We're also inside this auditorium. As I said, the Chief Minister has once again requested the public to get the vaccine as early as possible, because in the state of Tamil Nadu, the number of positivity, the case positivity rate is increasing rapidly. In fact, if we have to take from 31st of December to current period, that is 10th of January, the number has gone from nearly 1,000 positive cases per day to close to 13,000, and of which nearly 50% is from the city of Chennai alone. That's the reason the state government has gone ahead. The night curfew has been imposed, and not just that, Sunday total curfew was also imposed. And amidst all this, the health department is requesting the public to get the vaccine as early as possible, because the health department claims that once a vaccination is the people who get the vaccine both doses, they seem to have a higher chance of fighting COVID-19. In the state of Tamil Nadu, within the past 10 days, the positivity rate has increased humongously from 1,000 to nearly 13,000 now. What seems to be the factor behind it?
See, based on the last genomic sequencing of the last set of 75 samples which were sent, we found that 64 were Omicron. So compared to the earlier, before December 27th, for the previous 3 months, 99.8% were Delta and remaining unsequenced. But quickly it has changed, and first it became 35, 65, 35 Omicron, 65 in the previous whole genomic sequence. Then the next whole genomic sequence results out of the sample, it became 65, 35. And day before yesterday's sample results is 86% Omicron and 14% Delta. The tragedy is that, while Delta is losing steam as far as the number of infected, but it's still there. So Delta does cause higher symptoms, and even in Omicron, while people so far we are seeing mild symptoms, and those who are comorbid, and we have to be careful. So we are following the protocols. Tamil Nadu generally a tendency to hospitalize is there. People also tend to come, and doctors also. So we are telling them that unnecessary hospitalization for asymptomatic double vaccinated particularly should be avoided. So try to follow the Government of India guidelines fully, so that we keep the hospitals free for patients requiring treatment.
There are also reports that Omicron cannot be taken seriously because it's spreading rapidly and it's almost like common cold. Is it true? Do we have to take it that way?
We at administrative level don't go by general, we keep seeing statements. Something positive happens, good. But we cannot. Similarly, only we started with some other things, but it started submutating. So we have to, so far so good. Omicron and as gene drop cases are not having respiratory symptoms, deep lung symptoms. But again, I'm telling you, we shouldn't confuse. Some of the people are still being found with Delta. So this is a thing we should leave to experts. And on our own, we should not determine it's a common cold or it is a Omicron or earlier COVID. And even if it is so, testing centers are there. Once you are tested and found to be asymptomatic, we should go ahead with the protocols.
Many frontline workers and healthcare workers seem to be also getting this S-drop gene Omicron immediately. 200 from CMC Vellore and several from government hospitals. Any precaution methods taken for that?
Telling people to avoid, and probably, at some point of time, we'll also look at staggering the elective cases. Because the visitors coming with patients as one issue, and second is a lot of incidental COVID is there. They're already Omicron or S gene positive. When they come for some other treatment, they pass it on to the doctors. So we are also telling doctors that apart from PP and all in the COVID and other wards, the rest of the parts also, entry point, we have to have very strict follow-up of infection control practices. So we are working closely with them.
Thank you. So nearly 35.6 lakh people have been identified eligible for the booster dose, and the vaccine drive has been initiated in the state of Tamil Nadu by Chief Minister MK Stalin. This is Vivian, Pramod Madhav for India Today.